In the first two videos in this series, you learned about a youth network of care, how you can initiate building a trusting relationship with youth, and what treatment and recovery options are available to them, including Suboxone and Methadone. This video covers strategies to reduce harm, withdrawal and tolerance, as well as treatment and recovery plans. In your role as a service provider, it is important to talk with youth and their families or supports about ways to reduce the risk of opioid poisoning, death, disease transmission, and other harms. These can include things like carrying a naloxone kit and knowing how to use it, visiting a supervised consumption site, not using substances while you are alone, having access to sterile supplies, carrying emergency numbers on your phone, knowing the signs of opioid poisoning, communicating with supports, combating withdrawal symptoms, using apps like NORS and DOORS, avoiding mixing drugs, for example, alcohol with sedatives, and having a safety plan. Opioid withdrawal can occur when an individual reduces or stops using opioids. Sometimes the symptoms of withdrawal can be so uncomfortable and unpleasant that a young person may want to avoid seeking help for opioid use or be afraid to continue the process. Service providers can acknowledge the fear or worry and help youth recognize withdrawal symptoms. They can provide supports by partnering with a medical professional to relieve withdrawal symptoms. This can be done by prescribing non-opioid medications to reduce pain or nausea. They might also prescribe opioid agonist treatment. Common withdrawal symptoms include chills, sweats, nausea, diarrhea, anxiety, sleep disturbance, and muscle aches and cramps. Before initiating OAT treatments, you can assess the severity of a youth's opioid withdrawal with a clinical opiate withdrawal score. If Suboxone is initiated while other opioids are still in a person's system, sudden and severe withdrawal can occur. This is known as precipitated withdrawal. This can and should be avoided. It is important to know about tolerance when working with youth who use opioids. When we say tolerance, we're talking about a need for increased amounts of opioids to achieve the same level of desired effects. Tolerance is achieved by regular or consistent use of opioids. Tolerance is quickly lost when the amount or frequency of opioid use decreases. This decrease in tolerance increases a person's risk of opioid poisoning. Service providers should educate youth on this increased risk and provide them appropriate tools to prevent or reduce harm while working with them on a treatment and recovery plan. A young person needs to be a part of their treatment and recovery plan. They may want their plan to include opioid agonist treatment, mental health counseling, addiction counseling, live-in treatment, group therapy, individualized treatment, career counseling, or supports for basic needs like housing, medical care, sexual health, or life planning. Remember, there's no single approach to treatment. It may take trial and error, practice, and support to adjust the plan before finding what works for the young person. Every young person is unique. Their care should match their individual needs and hopes. Ask the young person about their treatment goals. Be sure to include them in the decision-making process. As a service provider, understanding all aspects of treatment for young people who use opioids will help you make a difference in the lives of youth as they continue on their wellness journey. For more information about opioids and supporting youth with opioid use disorder, please visit www.ccsa.ca/improving-treatment-together-project.